Vitamins to cure neuropathy and damaged nerves, pain in hands and feet. That constant pain in your feet and hands, or that feeling of tingling, heat or numbness that often bothers you at night, could be neuropathy. Is it possible to cure this? Of course. If you suspect that you suffer from this, today I'm going to tell you why this happens and what you can do at home to solve the problem, combating it at the root. You will see that in many cases it is even possible to reverse the problem. What is the best magnesium to treat this? Is it useful to take alpha-lipoic acid every day? Today you will discover the most important vitamin, the best supplements, and also the best nutrient that you should consume to resolve these symptoms and help regenerate damaged nerves, no matter how old you are. But be careful. I will also show you that pain and tingling are not the only symptoms they can cause. If you have nothing more than neuropathy, I'm going to reveal other very common ones that you should know about, so you don't miss the problem. And I will also show you the 3 warning signs that indicate that neuropathy is more serious so that you can recognize them and act in time. Look, neuropathy is damage to the nerves. Imagine that they are cables that connect the brain and spinal cord to the rest of the body. And just like cables, nerves also connect you to your brain and spinal cord. They have a protective covering or sheath that surrounds them, called myelin. Understanding this is very important to be able to heal. This sheath not only protects and acts as an insulating layer, but also helps transmit electrical impulses more quickly and correctly. But we often damage this protective sheath, whether due to poor posture when sleeping, sitting, a herniated disc, lack of vitamins, or due to aging itself. Parts of the nerve are left without this covering, that is, as if it were a bare wire. This can hurt, cause tingling hot feet and other symptoms that I will detail later. But in order for you to recognize the problem, it's important to understand that the damage can affect your nerves in 2 different ways. The first injury occurs in the nerves that control light, which is the light that connects to what we feel. In this case, we will have that sharp and boring pain, burning, numbness. This is called sensory neuropathy. And the second form of injury occurs in the nerves that control our movements, that is, in the motor part of our body. When it is affected, we will have different symptoms: muscle weakness, paralysis in severe cases, or muscle atrophy, such as muscle shrinkage. It may look like a stroke, but it's not. The list is very long, but the point here is that neuropathy does not always cause pain. In many cases, all of the components I mentioned are affected, even that which is very curious. Sometimes the nerves that control our balance are damaged and we lose our balance. Or there are people who cannot differentiate whether something is hot or cold. Now this is the same as having muscle pain. If we have muscle pain, we may have peripheral neuropathy. Yes, this term is another way of calling the same problem. Some doctors use the word peripheral because they refer precisely to these nerves, those that leave the brain and spinal cord and are found on the periphery of the body. And that is precisely where the damage occurs. But why can these nerves be damaged? And most importantly, can we avoid this? Let's look at the 5 main causes. Number 1, lack of vitamins. The most important for the proper functioning of the nerves are the B complex, mainly folic acid, which is vitamin B9, also B6 and B12. These vitamins can be missing for a variety of reasons. For example, not consuming enough meat of any kind, or something that is very common, having parasites in the intestine. Often these do not present the symptoms we believe. A lot of abdominal area, diarrhea, stomach pain, but they live there. They don't cause much discomfort, but they chronically steal vitamin B12, and over time, it manifests clinically in this way, like neuropathy. Number 2, remedies. Another hidden cause of the lack of these vitamins is the use of certain medications. The adverse effects of metformin, for example, which is used to treat diabetes, but today is also used to lose weight or even for polycystic ovary syndrome. Additionally, antacid medications such as omeprazole, used to treat stomach ulcers, gastritis, and gastroesophageal reflux, can cause a lack of these vitamins over time. So my first piece of advice here: if you take any of these medications, it is a good idea to get vitamin B12 into your blood at least once a year. My idea here is very clear. Look for the cause of the problem so you can combat it from the root. There are excellent medications and supplements to treat neuropathy. I'll tell you about it, but be careful not to mask the symptoms. Maybe what you're really missing is taking some vitamins, treating intestinal parasites, or correcting one of the other causes I'm going to talk about now. Number 3. Compression in nerves. Neuropathy can also occur when something compresses or squeezes your nerves. When should you suspect this? If you have taken everything but still experience pain, tingling, or other symptoms, the most common thing is that it is due to poor posture, the way we sleep, the way we sit, or spending too much time writing on the computer. But your nerves can also be affected by a tumor growing in your spine or a herniated disc in your lower back, causing neuropathy in your legs and feet. But it can also occur in any part of the spine. You may have symptoms of neuropathy, such as burning in your hands, due to a problem in your upper neck. In the vast majority of cases, this is due to muscle contractures caused by stress. Now, what happens if you are not lacking vitamins? You don't have any back problems. What else can cause this problem? You may have a hidden infection. There is a very common bacteria that affects men and women of all ages and can hide in our bodies, causing symptoms years after infection. There is a spirochete called Treponema pallidus, the bacteria that causes syphilis. It is much more common than you might think. The problem is that when we are infected, we may not feel anything. Over time, it inflames our body, damages our nerves, and can cause, in addition to neuropathy, dementia. But the good news is that even if the infection has been in your body for a long time, it can be treated with penicillin. Number 4, very high blood sugar diabetes. But that doesn't happen to everyone. Apparently, there are some patients who suffer from diabetic neuropathy, especially those who have had diabetes for a long time or do not control it as they should. In other words, this is one of the complications of the disease. Number 5, other remedies. In addition to the metformin and sunscreen I mentioned above, there are other very common over-the-counter medications that can also cause neuropathy. Did you know that high doses of vitamin B6 cause this? It's called pyridoxine-induced neuropathy, which is the other name given to this vitamin. But wait, didn't I tell you that B vitamins are good for reversing neuropathy? Yes, they are excellent for the proper functioning of our nervous system, but excessively high doses can damage the nerves. In these cases, the medicine becomes a disease and leads to symptoms of peripheral neuropathy such as tingling, numbness, pain, and muscle weakness in the hands and feet. But how do you know you really have neuropathy and it's not something else? Let's look at the 4 most common symptoms and also the 3 warning signs that indicate greater severity. First, tingling and numbness. It's as if your feet and hands are falling asleep, but for no apparent reason. This is the most important thing to suspect neuropathy. Sometimes you may feel a strange sensation of this tingling or numbness, but with a more painful tone, as if you have multiple pins or needles. In other cases, as if walking on cotton. Sometimes a person can't tell if they're touching something hot, like the pain of neuropathy. Well, it looks like something sharp or burning. It's as if someone squeezed your feet or hands or placed them in something very hot. Many call this neuropathic pain. I have had patients tell me that their feet feel like they are boiling, and I can tell you that this symptom can improve completely with the advice I'm going to give you. But remember, neuropathy doesn't always cause pain and tingling, and believing that neuropathy doesn't exist because you don't feel it is a serious mistake that fools even the best doctors. Other symptoms of muscle weakness. You feel like you can't grasp objects with your hands, or that your feet are weaker than normal. It's as if your muscles are tired all the time and can't do their job properly, but for no apparent reason. And the 4th symptom is balance and coordination problems. You may notice that you sway more than usual or have difficulty walking steadily, as if you are trying to balance yourself while walking on a rope, or as if your feet are constantly sliding on something slippery. Many confuse this with labyrinthitis, with vertigo, but it is not. And the treatment is completely different between the 2 problems. Now pay close attention. What are 3 signs that indicate greater severity? The first is a complete loss of sensitivity in the hands or feet. That is, you cannot feel anything, nor touch, nor the temperature for hot or cold, nor even pain. This should concern you and requires immediate medical evaluation as it increases the risk of injury due to lack of sensation. The second is the difficulty of movement. If you feel very significant weakness in your hands, feet, are unable to walk, are unable to grasp objects easily, or are unable to perform basic activities such as brushing your teeth or combing your hair, this may indicate serious nerve damage. Paralysis would be the most advanced degree. And the third warning sign, intense and persistent pain. In other words, pain that doesn't ease even with the medicines the doctor gave you or with the supplements you can take. The pain persists constantly and even worsens. Let's now see how to carry out the treatment. The two most important secrets to improving all neuropathy symptoms and even helping to regenerate damaged nerves are: Number 1. Consume enough vitamins, nutrients, and sometimes supplements that act as natural remedies. And Number 2. Avoid anything that harms your nerves. If you don't avoid what I'm going to mention, it will be difficult for the above to really take effect. In the first part, I want to talk about 3 natural compounds. The first is a substance very similar to a vitamin called alphalipoic acid. It is found naturally in many foods, red meat, organic meats, such as heart, liver, kidney, also in dark green vegetables, broccoli, spinach, chard, and also in dietary supplements. I will tell you how to use them. Normally, we produce this substance every day in our body, but the problem is that it is in low quantity. It's often not enough. That's why you should consume it, and it's very important. We need alpha-lipoic acid in each of our cells, as it helps protect the damage caused to our body by free radicals. In other words, it acts as a powerful natural antioxidant, as it attacks free radicals that oxidize us. But in addition to improving neuropathy, it also helps with diabetes, improves blood sugar control, and also has protective effects for the heart. As if that weren't enough, recent discoveries have shown that it has anti-aging effects. The problem is that many of us don't consume enough and need supplements. Studies have shown that doses of 300 to 600 milligrams per day are beneficial for neuropathy, and they cause very few adverse effects. It is important that you know that the improvement begins to be noticed from the 2nd or 3rd week of use and tends to improve even more over time. You can take it continuously before using it. It is important that you know these 3 precautions you should take. It cannot interfere with the action of other medications, especially those used for diabetes and hypothyroidism. Therefore, it is essential that you talk to your doctor before starting to take any type of supplement. Second, if you use insulin, this supplement can lower your blood sugar, causing hypoglycemia. And third, some more sensitive people may experience nausea, digestive problems, and bloating as part of the adverse effects. But in the doses I mentioned, it is very safe and causes few side effects. The second natural compound is very powerful. It's called insulin. The active ingredient of turmeric is a much-studied substance, very few adverse effects, a huge list of benefits, but the idea is very clear. Consuming it every day improves the symptoms of neuropathy and chronic inflammation. My advice is to add half a teaspoon to your ready meals, salads, soups, fruit smoothies, green juices, and even water if you want. But a secret you should know. For it to really work, activate and absorb curcumin in the intestine, you must mix it with black pepper. It could be just a pinch or the tip of a spoon. Or if you don't like pepper, you can add a little healthy fat, such as olive oil, avocado, egg yolk, chia seeds, and flaxseed. Mixing it with any of these foods, especially black pepper, increases its absorption by 2,000 times in the intestine. You can also consume curcumin supplements. They come concentrated in doses of 500 milligrams already mixed with their activator or black pepper. You can take them every day in doses of 1 gram, twice a day. The third, very important natural compound for healing nerves is magnesium. There are many types. The best and most studied for neuropathy symptoms are magnesium trionate, malate, gluconate, and citrate. All the advantages, disadvantages, and differences between each of them and how to take them are explained in the video we made about magnesium. Search the channel. In addition to these 3 natural compounds, remember to consume the most important vitamins for the nerves, that is, those from the B complex, especially vitamins B12, B6, and B9. Taking supplements of these vitamins every day can help overcome nerves, but be careful. They can also worsen the problem when consumed incorrectly or in excess. In fact, supplements are more important if you have any of the risk factors for vitamin B deficiency that I mentioned at the beginning. Now, another very important nutrient is omega-3, a very healthy fat that we find naturally in cold water fish mainly, or in fish oil. It can also be consumed in food capsules. If you take them, make sure they contain the fatty acids, EPA and DHA, and pay close attention. Of course, for all of this to work, you must avoid these 5 main toxins that destroy your nerves as much as possible. All symptoms of neuropathy get worse. First, it is almost impossible for alcohol to improve neuropathy if you continue drinking this type of drink. Secondly, reduce your sugar consumption. Often doing this improves virtually all symptoms of neuropathy. Number 3, avoid as much as possible all foods that cause inflammation in the body, such as ultra-processed foods, bad fats, fried foods, margarine and vegetable oils. By inflaming your body, they also inflame your nerves. Number 4, foods high in sodium, like commercially prepared foods, anything that comes in highly flavorful packaging. Sodium consumption increases fluid retention. This swells the body and worsens neuropathy symptoms. And number 5, pay close attention to allergenic foods. In some people, foods they are allergic to can trigger an inflammatory response. Therefore, identifying and avoiding foods that trigger gut allergies will help improve inflammation in the rest of the body. Now it's your turn to act. Neuropathy may seem like a difficult problem to deal with, but as we have seen, there are several natural and effective strategies to alleviate symptoms, regenerate nerves, and restore quality of life. It doesn't matter how long you've been dealing with this condition. You can take the first step today. Make conscious choices. Add the right nutrients, avoid the bad guys that harm your nerves, and be consistent in your care. Remember, your body has an incredible ability to regenerate itself as long as you provide it with the support it needs. You are not alone on this journey, and the transformation begins now. Take care of yourself, invest in your health, and take back control of your life, because you deserve to live without pain, with energy and well-being. Your future starts today. Decide to take care of yourself.